In Paris, we're just 2 weeks away from the end of the state's indoor mask requirement. But when making the announcement last week, Governor J.B. Pritzker noted the mandate would still remain in effect in schools, despite a recent court ruling that's caused confusion in school districts statewide. Joining us now is one of the doctors who has appeared at Pritzker's sides many times over these last 2 years, including at that announcement, Dr. Emily Landon, Executive Medical Director for Infection Prevention and Control at UChicago Medicine. Welcome back, Dr. Landon. So,
thanks for having me.
How low can we expect cases to fall in this current decline that we're in?
Well, we're really hoping that we see them fall as low as we've seen them, well below 50 cases per 100,000 per week, which would be in the low transmission category. We have the best chance of seeing that happen after this particular outbreak. Now, it's not a done deal yet. We still need people to be sensible, to be smart about things, to get tested when they're sick, to stay home when they're sick, to follow all of those guidelines in order for us to be able to keep sort of a lid on transmission. But the cushion of immunity that people have had because there were so many cases of Omicron is going to pay back, we hope, in dividends until there's a new variant that sort of breaks up our happy sort of nadir.
Of course, because you remember early last summer when, a lot of the restrictions were starting to roll back, and then Delta hit, and then Omicron right after that. How at risk are we of another surge based on another variant?
Super at risk. The reality is that until we have a global program for managing this pandemic, we're going to be at risk, at the mercy of the sort of evolution or the resurgence or the emergence of a new variant out there. And that could happen at any time. It's really important that we take the breaks that we get when they arise so that we can be prepared and ready to go when we need to take those precautions. I said in the speech, and I'm going to say it again here, that people are really sick and tired of working their world around COVID. We need people to take a break because we're going to need them to work their world around COVID again. And we can't have people that are so sick of wearing masks that they think that that not wearing a mask is more important than like the life of someone's grandmother. And that's where we are right now, I think. And we need to use this time of low transmission or lower transmission as we're approaching it to really give people the break that they need.
Now, the state is still fighting this court ruling from downstate against the mask mandate in schools. So which is the more important metric here in schools? Is it low case rates or high vaccination rates?
It's both, and it's sort of a combination of those, but really it's about community transmission. So kids can really drive community transmission. I know we haven't seen that throughout this pandemic, but that's because they haven't been in school. And in communities where they are unmasked in school, they are the drivers of the community spread. And there's pretty good evidence that school districts and counties and areas that do not have mask mandates are much more likely to have sick kids with COVID, and they're much more likely to have sick adults with COVID. And so we need to make sure this is not a punishment for kids or keeping them in masks longer. It's the difference is that we want to predict what's going to happen in a few weeks for adults, because adult businesses need to decide if they're going to keep a mask mandate. Little cities in Illinois need to make decisions about whether or not they're going to keep their mask mandate or stop their mask mandate, what metrics they're going to use. But schools, we really need to have a higher bar for safety. It's not appropriate for a school to change their mask mandate rules right now because a bunch of people in the community don't feel like they want their kids to wear masks. That could really endanger the healthcare in the community and the health of the community and the health of the kids.
So we're going to take a little trip backward or down memory lane with you, Dr. Landon. Nearly 2 years ago, you joined the governor for one of his early days daily COVID-19 briefings. It was your first. Here's a little bit of what you said then.
This isn't the life any of us expected, and certainly there are others who will make much greater sacrifices. And there are many more disappointments to come. But this isn't going to be forever, like the governor said. It will last longer than any of us want it to. But in the end, we will look back and see it as just a piece of what happened in our whole lives. And we have to remember that.
Now, Dr. Landon, as we're looking at that old clip from, mid-March 2020, no one is wearing a mask at the time. So obviously we know a lot more now than we knew then. And now it's just being framed as sort of the new normal. Should we expect this sort of back and forth with mandates for some time to come?
Yeah, that's the right thing to do. So mandates need to protect whole communities and healthcare systems. And that's what we were doing back in March of 2020. We didn't have the capacity or the ability to handle it if everybody got sick. And the sacrifices made in a true stay-at-home order are completely different than having to put a piece of paper or cloth on your face. So the reality of the situation is that people are making fewer sacrifices now. They're able to do a lot more things than they were able to do in March or April of 2020. And that reflects the balance, the sort of balance that we're coming to with acknowledging that this is a virus that is ruled by nature and science and not by us. And so we need to wait until we have, people should expect we're going to be on again, off again with masks and with other mitigation efforts until we get global control. And we can argue and we can say how much we want to stop paying attention to COVID. We can pretend like it doesn't exist, but the more of us who pretend like it doesn't exist, the more of us who pretend like it's not actually killing people, which it is, and then the longer it'll take.
And we've got about 30 seconds left. If the mask mandate could be lifted, what about other restrictions like the vaccine mandate and the proof of vaccine mandate? Could that follow?
Yeah, that's specific to Chicago, and I wouldn't be surprised if they decide that at some point they want to change that. There's a different calculus for vaccine mandates than there is for mask mandates. They're sort of a little bit different in terms of what they do to prevent things, and it may make sense to keep that a little longer.
Okay, Dr. Emily Landon, thanks as always for joining us.
Thank you.